and welcome to Dr. Sam's Anatomy classes. Myself, Dr. Azmi Mohsin, Professor of Anatomy. This presentation is about the osteology of the skull. This I've prepared for the students who are about to face their practical exams or the Viva Voce exams. So before they test, they can go through this test and assess your knowledge about the skull. And for rest, everybody else also who just want to revise the knowledge about the osteology of the skull, they can give this self-assessment test. So now let me brief you about this test, how it's going to conducted. There are around 18 slides, right? And each slide is of 1 minute each. In each slide, initial 30 seconds are for you and the next 30 seconds for me. So in the initial 30 seconds, you see the picture of the bone and the questions attached to it. You memorize your answers, and in the next 30 seconds, I'll be telling you the answers. So this way you can self-assess your knowledge about the osteology of the skull. Okay, so let's begin. Sorry for disturbance. Okay, so before beginning with the self-assessment test, let me tell you about the skull. Skull is having, because we're going to, discuss about the bones of the skull. So there are 22 bones in the skull. Human skull has 22 bones, and out of which 14 bones form the facial skeleton and 8 bones form the brain box or the calvaria. And if you include the 6 ear ossicles, that makes it 28 bones. Okay, so now be prepared with the coming slides. Number 1. Okay, question number 1, identify the bone and its side determination. So this is a temporal bone. It's a paired bone on both sides of the skull, and its side is of left side. Look here, this is the petrous temporal, this is the zygomatic arch, and down below is the styloid process. This is the squamous portion which forms the lateral wall of the skull. And first of all, you have the idea that which view you are seeing is the superior view. So if you see in the superior, you will find that it's of the left side. Okay. Now, identify the mark structure and its attachments. So this is the mastoid process of the temporal bone, and it appears by this end of second year of life. So it has an outer surface and a medial surface, right? And the attachments about it, like on the upper surface, its occipitalis bellies are attached, and on the outer lower portion there are attachments of sternocleidomastoids, splenius capitis, longissimus capitis. They're all inserted, right? You should know this. And then on the medial surface, on the inner side, there is origin of the posterior belly of the digastric, and above that is a groove for occipital artery. Identify the bone and attachments on its outer surface. So the bone again is temporal bone. Then here you see on it's a paired bone on both the sides. Then regarding the attachments, remember that there is temporalis muscle of mastication having a wide origin, a fan-shaped muscle, and that is covered by the temporal fascia, which is attached on the superior temporal line. And the mastoid, remember I told you on outer surface is occipitalis muscle also is attached, and the zygomatic arch on the inferior border provides origin to masseter. Identify the marked structure and its development. Okay, the marked structure means the colored area here. It is the palatine process of the maxilla, forming the hard palate. Regarding its development, let me tell you, it forms the only anterior 2/3 of the hard palate, like posterior 1/3 is by the palatine process. Okay, palatine bone. Then on its development here, it develops from anterior most portion, that is from the frontonasal process, and onto which there is incisors attached, and below to that, and from the two sides it is the the palatine process of maxilla, which develops from the maxillary process. The colored bone is ethmoid bone, and it contributes to forming the medial wall of the orbits, and it also forms the lateral wall of the nose, including the perpendicular plate of ethmoid, which forms part of the nasal septum. Then it also forms the floor of the anterior cranial fossa in the form of cribriform palate. The colored bone is occipital bone, having the largest true foramen magnum. Then attachments, which joints it participates, and really down below you're seeing is this basal portion of the occipital body of occipital, which joins with sphenoid, that it forms the spheno-occipital joint, then petro-occipital joint, then occipitomastoid joint suture, and then the occipitoparietal, that is called the lambdoid suture. Okay, so the green colored bone is the nasal bone. Sorry, not nasal, it is lacrimal bone. So lacrimal bone you are seeing here, it contributes to two cavities. It forms the medial wall of the orbit, and especially the area anteriorly that forms the lacrimal fossa. So it partly contributes to the lacrimal fossa on the on its lateral side, and on its medial side it contributes to the lateral wall of the nose. Okay, the colored bone is mandible and develops from the cartilage of the first branchial arch, that is Meckel's cartilage, right from the middle ear cavity down till the zygomatic bone, maxillary bone, and this mandible here. It this cartilage gets absorbed, forming this bone, and what remains is the perichondrium, and that perichondrium contributes to the formation of anterior ligament of malleus and the sphenomandibular ligament. Okay. Okay, the identified colored portion is the spine of anterior nasal spine. This is called anterior nasal spine. It is formed spinous process at the two nasal notch. The two nasal notch when meet from the two sides here. This is maxilla. The two nasal notch when we meet anteriorly, they form this anterior nasal spine, onto which there is attachment of the depressor nasi, and then it also provides attachment to the septal cartilage. The anterior inferior portion of the cartilage is attached to this. Okay, the colored foramen you have seen is the mandibular foramen, which is present on the inner surface of the ramus of mandible. Here you can see, and through this foramen, it's the inferior alveolar nerve and vessels that pass through in the mandibular canal, and it provides innervation to all the teeth of the lower jaw, and this nerve emerges out through the mental foramen to supply the skin here on the lips and the chin and all the gingiva over the incisors. Identify the colored foramen and the structures passing through it. So the colored foramen you are seeing here in the body of mandible, body of maxilla anteriorly, this foramen is infraorbital foramen, just below to the inferior margin of the orbits, and through which infraorbital nerves and vessels emerge onto the surface. And the infraorbital nerve is actually continuation of the maxillary nerve, and it provides innervation to the skin here and the lower eyelid, little wall of the little surface of the nose, as well as the cheeks, and deep below it also provides innervation to the the maxillary sinus. The colored foramen is foramen magnum in the occipital bone, and it's a true foramen, and the structures passing through this is the lowest portion of the medulla oblongata, and you have the first pair of ligamentum denticulatum attached on the two sides, and anterior to that will be the vertebral arteries, and posterior to that will be the spinal accessory nerve, as well as, and you'll have the anterior spinal artery, then you have posterior spinal arteries, then you have meninges, right? All the three meninges with CSF, that those are the structures. And don't forget the ligaments, the apical ligament of death, the vertical portion of the cruciate ligament, and membrana tectoria. All these structures pass through this. The colored area marked here, it is the frontal process of maxilla. Got it? So superiorly it articulates with the frontal bone, that's frontomaxillary suture. Then here on the lateral side, it articulates with the lacrimal bone, participate in the lacrimal fossa. Then here anteriorly it articulates with the nasal bone to form the nasomaxillary suture. Got it? And there are muscles, levator, superior, iliacnesi, as well as the lower portion of orbicularis oculi, they are attached to this surface. Identify the colored area, its contribution in facial skeleton. Okay, so the colored area is the zygomatic process of maxilla, right? So you can say this forms a suture which reaches into the floor of the orbit, and this in its upper portion is continuous with the zygomatic bone, and the lower portion winds from the anterior to posterior surface of the maxilla. It's continuous down below, and this surface forms the front of the cheeks, the bony surface of the front of the cheeks. Identify the colored structure and structures attached to it. Okay, so the colored structure pointing, these are the styloid processes directed downward, forwards, and medially. These two are these styloid processes. They are part of the temporal bone. They project between the internal and external carotid arteries, and this develop from the second branchial arch. There are three muscles attached to this: stylopharyngeus, styloglossus, and stylohyoid. And accordingly to they will now supply stylopharyngeus by glossopharyngeal, stylohyoid by facial, and styloglossus by the 12th cranial nerve, and there's a stylohyoid ligament also attached to it that also develops from the second pharyngeal arch. Identify the colored bone, its contribution to the facial skeleton. Okay, so the colored bone is the unpaired bone of the facial skeleton. Other one is mandible, and this is the vomer. So vomer forms the maximum area of the nasal septum, and it divides the two nasal cavities, and it articulates with the perpendicular bit of ethmoid as well as the perpendicular bit of palatine, and it forms an anterior also is articulated with the septal cartilage to form the nasal septum. And superiorly it has two ala, it forms the rostrum sphenoid, it forms the shindialysis type of joint suture. Identify the colored bone and its contribution to the facial skeleton. Okay, so the colored bone is the zygomatic bone, and this bone forms the bony prominence of the face on the cheeks, and it is a masculine feature. It is more prominent in males, and this contributes to the lateral wall of the orbits, also the lateral portion of the floor of the orbits, and it posteriorly articulates with the zygomatic process of the temporal bone to complete the zygomatic arch, and medially it articulates with the maxilla, and onto this there is facial muscles, zygomaticus major, minor, they are all attached to this. Identify the colored bone, its contribution to the facial skeleton. So the colored bone is the sphenoid bone. This is an unpaired bone of the calvaria, and it forms the floor of the middle cranial fossa, and it has three parts: the body, greater wing, and a lesser wing. Okay, so the body forms the roof of the infratemporal fossa, and the greater wings, they form the lateral wall of the orbits, and it has the lesser wing which is on inside, right? So that lesser wing separates the anterior and middle cranial fossa, and because of those lesser wings there is the two lobes, frontal and temporal lobes. There is a secondary sulcus formed between the two lobes of the brain. Okay, and that's all, I think. Thank you.